All right, all right, all right. Happy Friday, everybody. I am super excited about today's Tracy Talk. In this episode, I have the great pleasure of talking to the founders of Diversity in Diabetes. And I want to just start. I think everyone knows I'm Tracy Brown. I'm the Chief Executive Officer of the American Diabetes Association. I am one of the 34 million people who have been living with diabetes. I like to say thriving while living with diabetes. But I want to just jump right in because we don't have a lot of time, and we know I like to talk. But I want to just start by getting some introductions. We have Casey and Koisha here, but I want to take a few minutes just so that they can actually introduce themselves. And then we're just going to dive into some questions. So, Casey, maybe we start with you, and then Koisha will end with you, and then jump to it.
All right, sounds good. So, hey, everyone, and hi, Tracy. My name is Casey Creel, and I have been living with type 1 since I was 7 years old, so going on 19 years now. I'm on the path to become a certified diabetes educator, which is now a CDCES. And I currently am a medical assistant as well as the co-founder of Diversity in Diabetes.
Awesome. Yeah. Koisha.
Hello, everyone. Thank you so much for that hype reception, Tracy. You made me want to just get up and start moving. My name is Koisha Umemba. I am a registered nurse with a public health background. I am a certified diabetes care and education specialist, the co-host and co-creator of the People of Color Living with Diabetes Virtual Summit, and the co-founder of Diversity in Diabetes.
Awesome. That is awesome. Now, tell me, ladies, where are you? Where are you guys physically right now? Where are you located?
Austin,
Texas.
Austin, Texas. Hook 'em horns. Now, I heard. Now, I just want to make sure that I can validate this.
Yes.
You have some Arkansas ties?
Yes. I'm originally from North Little Rock, Arkansas. I lived there all my life, been in Texas for about 5.5 years.
That's fantastic. So I don't know how many people know, I lived in Austin as well for many years. In fact, my daughter, she's 17 years old. She was actually born in Austin. And then I lived in Bentonville, Arkansas. I've been here now in the DC area almost coming up on 3 years. But prior to that, I was living in Arkansas. So, Koisha, what's that pig suey thing? How's that go? I love it. Okay.
That's amazing.
All right.
Oh,
Okay, so let's get. I just have a question, Casey and Koisha, for each of you. Talk to me about how you guys started this Diversity in Diabetes. Like, how and why did you guys know each other? I mean, what's the backstory here?
So, a fun backstory of us, we actually met for the first time this year in March. So we were both tabling for the College Diabetes Network at a summit in Austin. And so that was the first time Koisha and I met. And so she walked around, she looked at the booths, and she kind of came back and we kind of just talked about the lack of representation, I feel like, in the summit and in the space. And I was like, wow, like I was thinking of that too. And so we kind of started there talking about a summit for people of color with diabetes and what that could look like. At first, it was going to be in person in Austin, but kind of, because of COVID, it was able to be a virtual thing, which was amazing because we were able to connect with so many people from across the world as well. And so it was a blessing in disguise, but that is where we kind of started.
Wow. So just kind of, well, nothing is ever really random, I don't think, but
yeah, I agree. Yeah. And I'll say, so for me, I really kind of I noticed the lack of diversity about a year ago. So I was presenting on engagement of African Americans and Blacks in the National Diabetes Prevention Program. And so in preparation for that talk, I was reviewing the stats at that time, using 2017 stats. There were less than 5% Blacks or African American diabetes educators. And so that was the first time I really kind of noticed we got to do something about this, because we know that diabetes disproportionately affects people of color, right? So we're talking about more hospitalizations, higher rates of diabetes-related complications, less likely to receive diabetes care and education. And the list goes on and on and on when it comes to the disparities in people of color. And so that's really where I kind of started, really noticing there was a need. It really wasn't until I went to that conference in March. I walked around. There had to be over 200 people there. There was probably 50 plus vendors, and there was only one other person of color besides myself. Wow. And so ironically, like Casey said, she was sitting there. She noticed the same thing. I walked around and I came back, and I actually heard her talking to somebody about it, or maybe you heard me talking to the next table about it. And she said, we've got to do something about this. And so I always like to say, I'm a person that's motivated, not by my words, but with action. And so when she said it, I thought, oh, this little white girl, she don't really want to do nothing. She's just talking, and we exchanged numbers, and 6 to 8 weeks later, she texted me like, so Koisha, are we going to do this or what? And the rest is history.
Wow. That's amazing. So what's the mission, and what are the goals of the organization?
Great. So you want to take that, Casey?
Yeah, you can go ahead.
So really, we want to create awareness, right? We want to advocate for people of color that are living with diabetes, certainly. But we have 4 pillars with our organization, or 4 focus areas that we really want to see more improvement when it comes to people of color that are living and managing diabetes. First and foremost, we've got to have that increase in diverse representation. So we're going to personally work on helping more educators of color become certified so that they can provide those services. But we'd like to see more healthcare providers of color as well. Secondly, and this ties into diverse representation of educators, is to increase that access to diabetes care and education. So we really want to be able, like Casey said, to use this opportunity. Yes, a lot of bad things came out of COVID, but there was also this opportunity now that we're all in this virtual space to increase access to diabetes care and education and supportive services for people really globally. Third, we really want to increase the awareness and knowledge of treatment options that are available. Many times people of color, they really don't know what's available. They don't know the devices that are out there and all the other tools that are capable of helping them manage their diabetes better. And lastly, we want to increase the utilization of technology in people of color, because we know that people of color are using, CGM insulin pumps at a much lower rate than our white counterparts.
Wow. So there's a lot to unpack there. Let me start with a couple of questions just around that. Why do you think, or what are some of the reasons or rationale around why there is a lack of diversity in educators and healthcare professionals? Like what's the underlying issue there? Why?
Oh, don't get me on this soapbox.
I was like, Koisha,
I think it's the same issue. I think when it comes to patients that have diabetes, right? So everything is not on the provider and everything is not on the patient, right? There's several reasons. I will speak personally from my experience, and this is something that we'll talk about later and how we're going to try to help. I am always contacted and approached by educators of color saying, Koisha, I really want to become a diabetes educator. I really want to get in the field and get my foot in the door. I can't find a job. I can't even find a volunteer opportunity. So that's one of the biggest issues. In order to become a certified diabetes care and education specialist, you have to sit for an exam. Depending on the pathway in which you apply, requires you to have either 1,000 to 2,000 hours of diabetes education. That takes a long time to get. And so unless you are working in that profession, or you can find an organization in which you can volunteer for to accrue those hours, it's very hard for individuals to become a CDE or CDCES now.
Wow.
So that's a short answer. I'll give you that.
Yeah. And I guess what motivated both of you all to get your, CDCES credentials? Like what motivated both of you? And how long have each of you been diabetes educators?
So personally, what motivated me was when I was diagnosed when I was 7. I knew from the very beginning I wanted to work in the diabetes space. When I was diagnosed, my parents and we were given amazing nurses who really helped me know that I am more than my diagnosis, and I can do anything I want with diabetes. So I really lived that as my motto. And so whenever I met the first person who didn't see that the same as I did, I knew it was my life mission to kind of help everyone understand that. I mean, just because we are people with diabetes, that does not mean that we cannot thrive with this disease. And so I think that's what really motivated me. I never knew what exactly I wanted to do in the diabetes space. I just knew I wanted to be in it. And so, yeah, one thing after another has led me here.
Wow. And Koisha, what led you here?
Well, personally, I have pre-diabetes, and I had gestational diabetes with my second son. My father has type 2 diabetes. I have an aunt that's had type 1 diabetes for maybe 40 years. Personally, I've just seen how it's affected my community, and I see everything that goes into why our healthcare outcomes are worse than other populations. And it goes beyond, as I've learned, and as I've been in this now for 8 years, it goes beyond the Black community. So, and that's why we say people of color. And when we say people of color, we mean all communities of color. So yeah, it's near and dear to my heart from a personal and familial level. And certainly as a nurse, I've taken care of hundreds, if not thousands of patients.
Wow. So I'm just going to keep going down because you said so much, Koisha, that the four focus areas that you all have. So increasing awareness of treatment options and or increasing the utilization of technology. I mean, when I started using a CGM myself, that was a major unlock for me to actually manage my diabetes and really get to for me, the thriving mode. I just felt like I had more information in terms of understanding the impact of what I eat. I mean, you think you know. Mm-hmm. Then, you when you're actually able to see that affects you differently. The lack of sleep. I used to be a night owl. Mm-hmm. I didn't really quite understand the impact that the lack of sleep had on my blood sugars. The same with stress. I am a type A, hard driving, I can do anything. And so I didn't even realize really when I was stressed. Mm-hmm. So there was just so many things, but the CGM for me was an unlock to knowledge for all of that. Mm-hmm. But I say all that to say, again, the same question: why do we believe that there is a lack of awareness of treatment options? And why do we believe that there's less utilization of this technology? I mean,
I can offer a couple of suggestions, and there are tons. So I think, in communities of color, there's certainly a bit of stigma attached to having diabetes at all, right? But ultimately, this is so important for us because of what you just said. You sound like a person that's empowered by the information that you're armed with, just by what that CGM tells you, right? Mm-hmm. And that's what we want for all patients. But what I found in caring for patients over the years is, especially patients of color, is that they go to the doctor and the doctor says, okay, you have diabetes, you're going to take metformin, or you're going to get on insulin, Lantus, whatever. And that's it. There is no, you have these options available to you. You have these devices available to you. And yes, sometimes patients are not active participants, right? Sometimes they don't do research on their own, and they're not well informed. And a lot of times we trust that the doctor knows what he's talking about. So we're going to just comply with his or her recommendations. I think we've got to do a better job of educating our healthcare providers. This is something Casey and I are extremely passionate about, and making sure that we are providing full disclosure of diabetes treatment options to all of our patients, regardless. And that's going to take some education, because we know all providers aren't aware of all of the diabetes treatment options that are available. So there's so many layers that we probably don't have time to dissect in this 30-minute segment. But we're ready to put the work in to really drill down to the root cause and come up with some real solutions.
Yeah. So, this COVID-19 pandemic has, I always say it's just shined a very bright light on some old problems, right? Diabetes was an epidemic in this country before the pandemic. However, with that said, we know that people living with diabetes and other underlying conditions are disproportionately dying and hospitalized from COVID-19. And then when you add that layer of people of color, the numbers get even higher. What, Casey, maybe I'll address this one to you. What are some of the things that you all have been doing specifically during this COVID-19 pandemic to address some of the issues?
So specifically, I think is just trying to help build community with the People of Color Living with Diabetes Summit. That was in August, so it was right when everything was going on. And I feel like being able to help build a community and connect people with someone who looks like them, to say, hey, I know you're going through this and I am too, and this is how I get through it, so maybe this will help you. So I feel like what we really have done starting off is to help connect other people in the community that looks like them and that has the same experience as them, for them to be able to share stories and situations.
Yeah. So that the summit sounds like it was pretty awesome, and I'm kind of sad that I wasn't a part of that, but because I would have loved to participate. But was there any ahas that came out of that summit for you guys?
Oh, yes, for sure. I feel like whenever Koisha and I started, it was more of we just wanted to do it. Like, we just want to do something where we are bringing the information that we got at the summit where we met, just bringing this information to this specific population.
And letting people have their voice
heard. Yes. And I think during the summit, it was just aha of, this is definitely some work that needs to get done.
Yeah, I remember before even launching, or it might have been the first day or either the week before, we knew we were going to go on to create this nonprofit, because the response was overwhelming. The messages we were getting in our social media DMs was like, I've never heard anybody speak like this before. I've lived like this, for 15, 20 years. I thought I was alone. I didn't think, anybody could relate. And I think it's so important, like Casey said, it's been really important for us to kind of build our following, build this community, because with diabetes, support is so important. And a lot of times in communities of color, you don't tell people that you have diabetes. You don't share your diagnosis. You don't share that, maybe your vision is going bad, or you're having issues with, with the feeling in your fingers and toes. And so it's really important that we create this community. And there's a community that exists. Let me say that first of all. Like, there's a huge, big diabetes online community that's been there, but everybody hasn't known about it. And so it's really important for us to connect people to one another, to connect to resources as well, and to partner, which is the stage in which we're in right now, is really looking for people and organizations to help us advance the work that we're doing, so that we can scale some of these programs we want to implement.
Yeah, so there's so many places that I want to go. I want to pick up on a string that you talked about here in a minute, Koisha, around stigma. But I do have a question for you, Casey, specifically with type 1 diabetes. So I have been, I am also involved in a lot of communities as well. And there's two questions. I often hear, and people have come to me about this, where I think that there's division and divisiveness between type 1, gestational, type 2, so on and so forth. And yes, they're all very different, right? Type 1's an autoimmune disease. We understand that. But like, what's your perspective on type 1 versus type 2 versus, 1.5 versus gestational? And, are we one community?
I'm so glad that you're asking this, because this definitely was an idea I had to, growing up, I definitely was that one who was like, oh, I have type 1 diabetes, and I didn't do this to myself. And so I really had to take actually learning what diabetes actually was. I think just growing empathy for other people too, and understanding that we are one community. We are all people living with diabetes. And our management may look a little different, but at the end of it, we are all in this together kind of thing. And I think once our whole community can kind of understand that and come to the same understanding, we're going to be able to do amazing things with like the price of insulin and just stigmatizing diabetes in general. Once we come together, I think that's really going to help with a lot of things that is wrong.
Yeah. So there is a question. I'm trying to filter the questions too as they come in, that picked up, Koisha, on the stigma. And the question says basically, or the question and statement, there is a stigma attached to diabetes, all types of diabetes. Education does help increase awareness. What are some educational resources available to the public? And are there any specifically addressing stigma?
Yeah, so there's like 3 questions in there. So the first thing I'll say is if we're gonna do anything with the stigma, right, we've got to start talking. And so I remember specifically talking, I can't remember who I was interviewing for the summit, but we have to stop keeping things private. And I'm not saying share all of your, protected health information, but certainly, finding that community and talking about your shared experiences. That's first and foremost is communication. Yes, education, absolutely. It's often said knowledge is power. That's not necessarily true. Activated knowledge is power. So, learning, but then putting some action behind that to actually implement the steps needed to see improvement in your life. And then what was the other question? What are some educational resources to the public? There's a lot of educational resources. I don't think we have a lack of that. When it comes to stigma, you can go to, American Diabetes Association. And right now y'all have a great health equity campaign and diversity campaign. Certainly the CDC website as well. A number of diabetes companies and certainly individuals that we partner with have a lot of good information as well. I think actually what's probably more beneficial is getting with people that look like you and also that don't look like you and just talking about how you feel. Get with a diabetes educator who can help you, or a health coach, diabetes health coach that can kind of help you talk about, some of those feelings and that stigma that you associate with having that disease. Like Casey said, you can thrive with diabetes, but a lot of times people look at it as a death sentence. If you've progressed to now you need to start using insulin, if you were type 2 and, started off not on insulin and now you've progressed, there's a stigma attached to that. So a lot of that is getting with the diabetes educator, having a empathetic, understanding provider that's going to take the time to help you explain some of those things. If we do better, I think, as healthcare professionals and educators in explaining things when people are newly diagnosed, we wouldn't have that stigma. But a lot of times, like Casey said, I didn't do this to myself, because that's what we think, right? Most people think that type 2 people with diabetes, they do it to themselves. And so we've got to stop saying things like that and making patients feel that way. And that will help squash a lot of those feelings associated with stigma.
That is, that's 100%, 100%, correct. Couldn't agree more. One of the questions also is, does everyone have access to the diabetes health coach and a diabetes educator? Like, how do you, like, if you don't have one now, how do you get one?
Well, I'm so glad you asked, Tracy. So like we said, we've got four main initiatives, right? And if you'd like to read more about those, you can visit our website, diversityindiabetes.org. When it comes to the knowledge of diabetes treatment options and increasing utilization of technology, we'd love to find some organizations that can really help us partner on those areas. But when it comes to increasing the representation, diverse representation, and bringing access to individuals that otherwise would not have a diabetes educator or health coach, what we want to do, or what we are doing in 2021, is implementing a volunteer educator model. So we're going to help those CDEs, RDs, health coaches, et cetera, that are trying to become certified diabetes care and education specialists and are looking for those hours of volunteer. We're going to help them by giving them that opportunity to provide diabetes education the same way that we're on this platform now. And then those individuals that don't have access, they're going to be able to participate in diabetes education, diabetes program, virtual fitness classes, all of that free of charge. And so, as you can imagine, that is a lofty goal, right? So we're going to need some help to do that. So if you want to get involved and if you want to partner with us, let me put another shameless plug in.
Plug it up, plug it.
Go and visit the website. The application is there. If you're looking to partner, if you have a resource you want to share, please go visit diversityindiabetes.org. We are new and we're looking for ways and ideas that we can bring this kind of this service and this information to the masses.
That is fabulous. Okay, so we have more questions rolling in. So here's one that is, I don't think doctors are properly trained to deal with people of color who have diabetes. What advice would you give the professional community?
Oh, that's a great question. I'll take this, Casey, because I spoke about this yesterday at the Diabetes Mind Innovation Summit. So there's 3 things that I say doctors can do. Well, there's a lot more than that, but I'm gonna try to keep it short. One, become better allies, right? And so we know an ally is a person that unites for a common cause. Usually there's a mutually beneficial alliance, right? Be a better ally. That means being empathetic. That means putting yourself in your patient's situation. That means you've got to listen and try to understand. And that means you've got to be intentional with your efforts. I really think that providers don't do a good job, as I've said, of providing full disclosure. So, a patient comes in and, Mr. and Mrs. Jones, I know they're not going to do what they're supposed to do. So let me just give them some metformin and send them out the door, right? There's no full disclosure of everything that's available to them. Don't make an assumption on what you think they can afford or what you think they can manage or not. At least provide that full disclosure. Secondly, refer everyone, period. It's so simple. I say it all the time when it comes to diabetes education. Refer everyone, period. If they don't go, okay, follow up. See if there's some other services that they need. Maybe it's just transportation, but refer everybody. And we're seeing, I know personally, I have seen where providers will say, well, she probably wasn't going to go anyway, so I didn't worry about referring her. And then also follow up is needed, not follow up as needed. Follow up is needed, especially if it's someone that's newly diagnosed, especially if you've recently changed, the regimen. Follow up to call in. I'm just checking in. I'm seeing how you're doing. Are you struggling with anything? Do you have any questions? How's that medication? Again, I could go on and on, but those are just a few tips that providers can use.
That's awesome. And so, we get in the blinking lights that we're supposed to wrap up, but there's some good questions in here. So I'm going to keep asking. Did we lose Casey?
We did. Uh-oh. Come back in, Casey.
Okay, Koisha, there's a couple more questions. So there she is. Okay.
Hey, sorry, I don't know what happened.
I don't either. Okay, so here's a question. Do you think it's best to preach nutrition or unity within the diabetes community?
Wow.
Yeah, I think first, unity, because then that would come into more diabetes education. I think whenever we have unity, then we're able to, share freely all of the really good diabetes management that's out there. So I think to start, unity for sure. That is,
I would agree with that. I think sometimes, especially from in the Black community, we have to see somebody else doing it. So I think you're right. So if we have a sense of unity first, and we can bring some people on board and say this is what we're doing, or this is what's in, or this is how we're eating, it may be a little bit easier to bring the nutrition in. But yeah, we can certainly do both.
yeah.
Okay, so then I guess if I can sneak one more, or maybe even two more, one more in. It says, how is Diversity in Diabetes advocating for affordable insulin for all?
Oh, you want to take that one, Casey?
Yeah, I can. First, I think that's such an important topic. I've done a lot of work with DPAC, which is Diabetes Patient Advocacy Coalition. I went to DC, so I think this is a very important topic. And so hopefully we are wanting to develop advocacy materials and toolkits for our audience, and so that definitely will be included. So I think that's definitely one, is helping people know how to advocate.
Awesome. So listen, I feel like we just scraped the surface. So I think we need to do Tracy Talk Part 2 with diversity and diabetes, and have you guys on so that we can go deeper. But as we wrap up, I have a question, and then I will give each of you the final word. If you had one hope in 2021 for the diabetes community, what would it be?
Oh,
I know what my hope would be.
okay, you go first then.
Yeah, my hope is just for us to show empathy for one another. I think that's a very important thing. I think that would help with the division between the different types of diabetes, and the different communities that are within the diabetes community. I think that would really help with just stigma with diabetes in general.
I guess I would say I want us to just start talking
to
one another, and start talking about diabetes and living and thriving with diabetes, because it coexists.
That is fantastic. And I want to close by just saying to both of you just how grateful and thankful that I am as a person who is living with diabetes, to know that the two of you are doing so much great work for our community. And if we're going to take diabetes down, if we're going to enable more people to thrive, it actually takes all of us working together. And you all have shared some very rich information. I'm grateful for that. I want to give another plug on top of what Koisha said earlier, diversityindiabetes.org. Go to the website. This volunteer education model that they're suggesting, get into that. Volunteer. Let's bring it together. Let's work together. And as Casey and Koisha has said, unity. Show empathy for one another, and just start talking. I'm going to use those two suggestions from the two of you. Awesome, awesome, awesome women. Thank you for spending some time here on a Friday night with us. And I'm going to have you back, because there's more to do. And I'm just grateful and thankful. Thank you very much, both of you.
Thank you so much.
So much for having us, Tracy.
Yes.
So much.
Awesome. Awesome. Go Austin, Texas. Go Suey.
Yes. All right. Thank you so much, Tracy.